Well, good afternoon, everybody. We're back for a briefing today on Sunday. As we indicated yesterday, I am joined by Dr. Morrison, as always, and again today, Norbert Carpenter from the Public Schools branch. We will answer some questions at the end after Dr. Morrison and Norbert have some comments, and I'll just pass it over first to Dr. Morrison to give us the most up-to-date information.
Thank you, Premier. Good afternoon. So today I will update the situation regarding COVID-19 and P.E.I, specifically in relation to one of the cases announced yesterday. I am pleased that there are no new cases to report today. Yesterday, I announced 2 unrelated cases, both young males under the age of 20. This brings our total case count to 72 since the pandemic began, and the number of active cases in the province to 4. One case announced yesterday is an individual who recently traveled to P.E.I and has been self-isolating since he arrived in the province. He is not part of the school system in P.E.I. The second case is an island student who attends Charlottetown Rural High School and plays on a local under-18 hockey team. He has no history of travel outside of P.E.I and is self-isolating at home. With that said, yesterday, our initial investigation focused on 2 priority areas. First, to identify contacts of the second case and to arrange for testing of all contacts related to the second case. A total of 70 close contacts and 283 casual contacts associated with the second case were identified and tested yesterday. My daughter pointed out to me last night that I should do a better job explaining the difference between a close contact and a casual contact to help make it easier for people to understand. A close contact is someone with whom you've been near, within 6 feet of each other for an extended period of time. So close contacts include people who live with a case or live with you, people you have close face-to-face contact with, such as people you sit down and eat with, people you sit near in the classroom, someone you sit beside on the school bus, or someone with whom you share a vape or cigarette or kiss. Close contacts can also include people who may have had contact with the case even prior to the onset of symptoms. A casual contact is someone with whom you have had brief interaction with and you were not in close contact with for an extended period of time. For example, a casual contact is someone who may have been sitting somewhere else in the restaurant at the same time but did not sit with you, or traveled on the same bus but did not sit near you. Essentially, casual contacts are people with whom you've not had any close contact, were not within that 6 feet for an extended period of time. Close contacts of a positive case of COVID-19 need to be tested and self-isolate for 14 days. Casual contacts need to be tested and self-isolate only until they receive a negative test result. Today, Public Health Nursing will be recontacting all 70 people identified as close contacts of the case for the second time, just to confirm that they need to self-isolate for 14 days, regardless of a negative test result or whether they have, and they will also be determining if they have any symptoms or not. Others who do not get a call from Public Health Nursing today do not need to self-isolate for the 14 days. They are considered casual contacts and can go to work and school provided they have received negative test results, but continue to closely monitor themselves for symptoms and pay extra attention to hand hygiene, physical distancing, and wearing a mask in public places. Over the last 24 hours, just over 1,100 people were tested for COVID-19 across the province, including individuals associated with the cases announced yesterday. And so far, all the test results have come back negative. The provincial laboratory staff worked late into the night and this morning to ensure all the tests were processed in a timely manner. To meet the increased demand, Health P.E.I expanded the hours of the testing clinics in Slemon Park and Charlottetown and set up a satellite clinic in Stratford. The testing clinic staff worked late to ensure that no one was turned away from the clinic, and everyone who presented for testing yesterday was tested. Public health staff contacted 353 people by phone yesterday to advise them that they needed to be tested. The gold standard for contact tracing is for it to be completed within 24 hours of the identification of a case. And despite the large number of contacts in this situation, we definitely achieve this standard. From a public health perspective, and as per our prior work about how we respond to cases in schools, our recommendation to the public schools branch would be that the school does not need to close at this time. There is enhanced cleaning that is being completed today. There is mandatory masks for all high school students throughout the province starting tomorrow. And this has also provided the opportunity to review all operational plans to ensure that what we've learned from in the last 24 hours provides an opportunity to enhance the measures that are currently in place in schools and in organized sport. I also would like to go on to thank everyone who went above and beyond to support our prompt response to this situation. Thank you to everyone who received a call advising them to be tested. They were understanding and cooperative. Thank you for responding so quickly and doing the right thing and going to get tested. Thank you to the many youth who are impacted by this situation. Thank you for being tested. And for those who need to self-isolate, thank you for being willing to protect your health and the health of your friends and families. I know that getting a message that you have been in contact with someone who has COVID-19 is scary, and thank you for your cooperation. Thank you to Health P.E.I. staff, including the testing clinic, lab, and public health staff and administration. Thank you to Island EMS for supporting the testing clinics. And thank you to the Department of Transportation for helping with testing clinic logistics. Thank you to Hockey P.E.I., the Charlottetown Minor Hockey Association, and everyone associated with the Sherwood Parkdale Minor Hockey Under 18 Central Team Number 2, including parents, coaching staff, officials, and referees. Thank you to the Public Schools Branch, Department of Education and Lifelong Learning, and the staff, administration, parents, students of Charlottetown Rural High School. Our office does not release names of individuals with any communicable disease, including COVID-19. There is legislation in place to protect the rights of Islanders from the release of this information. We are aware the name of a person was released on social media yesterday. We do not condone the identification of anyone who may or may not have a communicable disease. A wonderful part of living in Prince Edward Island is a feeling of closeness and being connected through many social and family ties. While this sense of comfort and familiarity makes P.E.I. a very special place, it does not negate our right to privacy, especially when it comes to our personal health information. I want to assure Islanders that our system responded appropriately and efficiently to this case that involved 353 contacts. I've stated previously that our system is ready to respond to cases when necessary, and the results of our collective efforts in the last 36 hours is further evidence that we continue to be poised to respond and take the necessary steps to contain the transmission of COVID-19 in our province, including early identification, isolating, testing, contact tracing, and quarantine. Our investigation is ongoing, and at this point we are unable to identify a single source of infection. However, it is very likely related to importation and travel outside of P.E.I. Public Health will continue to investigate the situation and leave no stone unturned in an attempt to identify the source for this case. Our work over the next few days will be important to help determine if we are able to identify a firm linkage. We have been fortunate with all our previous cases in being able to identify a source or linkage, giving us confidence that all our previous cases were related to out-of-province travel. Given the amount of testing completed in P.E.I., including 3,000 tests in the past week alone, I am reassured that we do not have widespread community transmission in P.E.I. This situation is a good reminder of the importance of following the basic public health measures. We all assume the person next to us may have COVID-19. So I urge all Islanders to pay extra attention to the following: increase hand washing and surface disinfection, Maintain a physical distance from people outside your household. Wear a mask when in public places. Keep your circle of contacts as small as possible. And if you develop symptoms of COVID-19, please arrange to be tested and self-isolate until your test results come back. Stay home from work and other events when you are not feeling well. Islanders are encouraged to download the free National COVID Alert app as an additional tool to help prevent the spread of the virus. This situation highlights how important it is for all of us to keep track of our close contacts. And we spoke about this many months ago, and I would urge Islanders to keep track of your close contacts. This record and will help us improve our ability to do contact tracing in the event of an exposure to COVID-19. As we continue to look out for one another, knowing that COVID-19 could be in our community, please continue to be patient and kind toward yourself and others. Thank you very much.
Je vais peut-être faire juste quelques remarques en français. Il n'y a pas de nouveaux cas annoncés aujourd'hui. On est rendu à 72 cas au total. Et j'ai plus d'informations pour les 2 cas qui ne sont pas reliés hier. Un cas est revenu de l'extérieur et s'est isolé tout de suite comme il devait. Il ne fait pas partie du système scolaire. L'autre est un étudiant à Charlottetown Rural qui joue au hockey. Il est en isolement chez lui. Nous avons identifié 70 contacts proches et 283 contacts simples pour ce deuxième cas. La différence entre les 2 types de contacts, c'est qu'un contact simple, c'est quelqu'un que tu vois brièvement, qui n'était pas physiquement proche de toi ou pour longtemps. Les contacts proches d'un cas positif doivent se faire tester et doivent s'isoler pendant 14 jours. Les contacts simples doivent se faire tester et doivent seulement s'isoler jusqu'à ce qu'ils reçoivent leurs résultats négatifs. La santé publique va contacter tous les contacts proches pour confirmer aujourd'hui qu'ils doivent rester en isolement. Si vous ne recevez pas d'appel de la santé publique, vous êtes un contact simple. Vous pouvez continuer avec votre quotidien tant que vous avez reçu un résultat négatif, mais s'il vous plaît, faites attention aux mesures sanitaires. Nous sommes au courant que le nom de l'étudiant est sur l'Internet, mais ce n'est pas notre pratique de nommer les individus. Nous ne tolérons pas cette pratique. Tout le monde a le droit à leur vie privée. L'enquête de ce cas avec l'étudiant n'est pas terminée, mais pour le moment, nous ne pouvons pas identifier la source de l'infection. La santé publique continuera le travail dans les jours qui suivent. On a été chanceux jusqu'à date que tous les cas ont été identifiés avec un lieu au voyage hors la province.
Merci, et puis I'll pass it over to Norbert.
Thank you, Dr. Morrison, and good afternoon. As announced by Dr. Morrison, there are no further cases identified in relation to the positive case at Charlottetown Rural High School. And I do want to take this opportunity to thank her team and the staff at the school, the administration, staff at the public schools branch, and all parents and students for their cooperation. This was a monumental task. Charlottetown Rural is our largest school with 1,056 students and 99 staff in the building every day. So we are the education authority in this case, and we represent the students, the educators, and all staff in the building. So our job is to operate the facilities and ensure that learning can take place. So in cases like this, we have many boxes to check, and that's what we've been doing since we were notified early yesterday about the case. So we're confident that the work has been done, and we respect and applaud the work of the CPHO and take advice from them related to the local epidemiology related to the cases. So on that note, Charlottetown Rural High School will be open on Monday. A specialized cleaning service has been deployed where 24 cleaners are on site with several site managers for a deep cleaning. That's taking place today. The buses are similarly being sanitized, so the 2 buses that were implicated, bus number 23 and bus 3. Additional counseling services and supports will be at Charlottetown Rural this week to offer support for students who may have concerns. And for those students who are required to self-isolate, remote learning will be provided. These students are being contacted directly to determine technology that they may need at home, and the distribution of such technology will be done by the PSB. And parents and students who have concerns about returning to school, we will provide some phone numbers on our social media posts and our website so that you can get in contact with us, and we'll take care of those concerns and make sure everyone's feeling safe and secure returning to Charlottetown Rural tomorrow. And just a reminder, as Dr. Morrison said, we have mandatory masking in place tomorrow for grades 10 to 12 students. And of course, that would include all students and staff at Charlottetown Rural High School. Thank you.
Well, thank you, Dr. Morrison and Norbert. Certainly much better and brighter news than maybe we had been bracing for this time yesterday, but much work remains. And with that, I will turn it over to some questions from our friends in the media who happen to have drawn the short straw and working on Sunday.
Travis Kingdon, CBC.
Hi, everyone. Good afternoon. This question is for Dr. Morrison. In there, you had mentioned that you're not able to identify the single source of the infection just yet, but you said it's likely related to travel outside of P.E.I. Could you tell me a bit more about the contact tracing and why you're kind of leaning towards likely related to travel outside of P.E.I.?
Hi, Travis. I think it's really based on some of the history and what we are learning about the close contacts, and of course we're looking at the timelines and about both from symptom onset prior to symptoms when the case was had contact with people from who may have traveled outside of the province. So these are always difficult, and this happens in various parts of the country in different cases. That sometimes it's difficult to confirm the linkage, but we'll continue to investigate, and as part of our work in contact tracing. But at this point in time, there are certainly indication that it would be linked to travel outside of the province.
Thank you for that. And that just to clarify for myself there, that's some of those close contacts did have some travel outside potentially of the Atlantic provinces, or outside of P.E.I. rather.
Outside of Prince Edward Island. And just to reiterate, the close contacts of the case are going to be in self-isolation for 14 days, and they're all being recontacted today.
Thank you. And then a quick follow-up question for you, Dr. Morrison. Province is currently in the green zone. This is a very a larger scale kind of testing effort and exposure that we had seen before. At what point would you move from a green zone to the yellow zone in terms of restrictions in the province?
Travis, we've been actively looking at that for certainly a number of days, and we really will continue to look at our epidemiology here, as well as in our neighboring provinces. And a lot of the measures we put in place, including the announcement last week of anyone who travels outside or returns from travel outside the province has to isolate for 14 days. So some of our points of entry are to try to keep us in that green level as long as we possibly can. And I mean, I didn't say it officially in the notes, but I think every day that we are able to, that we will be able to function in what we had called the new normal, we are so grateful for. And 8-9 months into this, we have lots to be thankful for, and we'll continue to put the measures in place that will help us be in that green zone as much as possible. But we are continuing to monitor when we might have to move and change things.
Thank you.
You're welcome.
Shane Ross, CBC.
Hello. This is a question could be for any of you. I was wondering, do you believe there is a stigma attached to having COVID-19, and how do you address that? Are you worried about bullying at all?
Well, do you want me to, I do think there's a certain, fear connected to this virus for sure, and for good reason. I do think there is a bit of a stigmatization, I guess. It's probably, one of the great advantages we have in P.E.I. is our size, so we're able to undertake an effort like we have done for the last 24 hours, probably with a greater efficiency than many of our other provinces across the country, so that is a good thing. But our small size also makes it probably easier to identify somebody, and to that I would just say to all Islanders that the individual involved here is 15 years old. He's a regular teenager who's trying to live a normal life in very abnormal times, and he needs our support. Our first response to hearing this should be making sure that he is well and that he's getting better and that he's recovering. Because that's who we are as Islanders. And I would say he deserves, he deserves our support. He doesn't deserve public shaming. He has nothing to be ashamed of. He had symptoms of COVID. He went and got tested. He's isolating. He's working with CPHO to identify his close contacts. He's doing everything he's supposed to be doing. And for that, we should always be mindful of the fact that this isn't the 74th case in P.E.I. This is an individual who lives in Prince Edward Island, someone who needs our support, our respect, and our love. And let's, in the middle of all this crazy times that we're living, let's not forget that.
Thank you. I was also wondering, were students from other schools on the bus with the Charlottetown rural student?
So during our contact tracing with CPHO, some students who attend other schools may have been identified to be on the bus, but they've all been encouraged to seek out a test, and to our knowledge, most have, and the test has been rendered negative, and they have been given advice they would have to self-isolate until they have a negative test.
Mike Robar, Guardian.
Good afternoon, everyone. My first question is for Dr. Morrison, and basically, if the contact tracing has been complete, what's left to try and determine the source of the initial contact?
So, I think there will likely still be some tests that will need to be done over the next day or two. For instance, people who may have had some public exposures or at the listed locations from yesterday, we may still be doing some testing. But also our close contacts will actually be retested, for instance, in the upcoming 14 days. And usually we're going back to speak to our cases, and sometimes we get more history. We start going back, talking about timelines in more detail, and it's hard for people to remember everything all at once. So sometimes further conversations give us a little bit more information, and so that's all part of it, and sometimes even our close contacts will remember certain information as well. So the public health nurses do a really good job at helping ask the right questions and exploring some of that history when they go back and talk to cases and close contacts again.
Thank you. And then as a follow-up, I guess it's to anyone. What would you say to parents who might be afraid? I know Premier King mentioned fear around COVID-19. What do you say to parents who might be afraid to bring their students back to school on Monday, or might be thinking about pulling them out?
Do you want me to start and then you? Maybe I'll start and then I'll put it over to Mr. Carpenter. My daughter asked me that question last night, late at night. She said, if I was at Charlottetown Rural, would you let me go back? Would you want me to go back? And I think that's probably the question that other parents are having to answer from Charlottetown Rural. And my answer was, based on what I know now, yes, I would. But I'd want you to wear your mask. I'd want you to wash your hands. I'd want you to do all the things that you're doing now to try to, make sure we're safe and following these public health measures. And I'd make sure that if you were not feeling well, you shouldn't go. And we'd want to test you. But I said at this point in time, it's one case. There's not a cluster. There's not an outbreak at the school. And if any of that happens in terms of a cluster outbreak, then my answer would be different. So anyway, I'll start there and I'll let...
Sure, and I'm not sure I can say it any better, but we are in the people business and we care deeply for our staff and our students, and we're very fortunate. We have a tremendous team at the Public Schools branch, the Student Services Department, and they will be on the ground tomorrow to make sure students and staff feel comfortable. And one of the numbers I mentioned earlier that will be available will be directly to Student Services, and we'll take those questions and we'll work with parents to help their students attend school. We want everyone to feel safe, and I just want to say we're so fortunate to be able to be in a position where we can offer learning for everyone, and we certainly are committed to doing that.
Laurent Rigaud, Le Bois.
Good afternoon to you all. Docteur Morrison, j'ai une question en français par rapport. En gros, c'est la question qui vient d'être posée en anglais. Qu'est-ce que vous dites aux parents qui demain doivent conduire leurs enfants à l'école? Est-ce qu'ils doivent être inquiets ou est-ce qu'ils peuvent y aller sans inquiétude?
Bonjour Laurent, et puis comme j'ai dit en anglais, je pense que c'est important que les parents s'assurent que les enfants ne sont pas malades, ils sont bien, et puis ils mettent leur masque. Les masques sont obligatoires maintenant pour 10 à 12e année ici à l'île du Prince-Édouard. Alors mettre votre masque, laver les mains, garder la distance autant que possible. Et puis, si quelque chose change, on va vous informer. On va changer le plan, mais à ce moment, j'irai à l'école.
Et juste une autre question. Je pense que vous y avez aussi répondu en anglais. Maintenant que tous ces tests ont été faits, qu'est-ce qui reste à faire? Est-ce qu'il y a tous les contacts ont été identifiés? Quelles sont les prochaines étapes par rapport à cette affaire-là?
Alors, on va les contacts qui sont très proches, vont rester s'isoler pendant 14 jours. On va les faire retester. Alors, on doit faire ça. On va les contacter chaque jour pour voir s'ils ont les symptômes. Puis, si on a les symptômes, on va les faire retester tout de suite. Et puis, souvent, on explore, on fait l'histoire encore avec le cas, des fois les contacts, pour voir s'il se souvient quelque chose de plus à propos de ce qu'ils ont fait, les contacts qu'ils ont eus. Mais c'est un exemple où on voit assez de contacts qui sont close contacts avec quelqu'un. 70, c'est un grand nombre. Alors, le plus que possible, on doit avoir un nombre de contacts qui est plus petit que ça, mais
Ça, c'est les sortes de choses en général qu'on va continuer à faire les tests de personnes qui peut-être sont pas identifiées encore, mais on va continuer à faire les tests.
Merci.
Brett Bundle, Canadian Press. Brett. Rose St-Pierre, Radio Canada.
Oui, bonjour, Dr. Morrison. Une question pour vous. Pourquoi c'est difficile en ce moment d'identifier la source de l'infection pour cet élève de Charlottetown Rural?
Bonjour, Rose. En effet, on est en train de faire tester les contacts qui sont identifiés. Et puis, des fois, on essaie de faire tout ça. Des fois, on va déterminer ça des jours dans les prochains jours. Des fois, c'est difficile de déterminer pour certains la source. Les autres cas qu'on a eu ici à l'île Prince-Édouard, c'était un peu plus facile parce qu'ils venaient directement de voyage. Mais c'est pas toujours le cas. Mais on essaie de continuer de faire l'investigation, plus de tests, parler au cas et aussi les contacts. Mais tout ce qu'on comprend à ce moment que je pense que on pense que c'est lié à un voyage hors de la province.
Merci.
Thank you, everyone. I'll just close with just a couple of comments, just echoing really what Dr. Morrison and Norbert have indicated here earlier, that it's been an incredible team of people, incredible effort these past 24 hours or so, who acted quickly and efficiently. And when we needed everyone to come together, we did. And so that's certainly a great source of pride, but also of comfort to me and to all Prince Edward Islanders. We moved quickly yesterday because we saw an increased need for testing. So we set up a temporary site in Stratford. That was a tremendous undertaking, and it helped not only take the pressure off the site at Park Street in Charlottetown, but it also, I hope and believe, help to alleviate the heightened level of concern that parents, teachers, and students and others have had by offering the quick access to the test. So I'm glad we were able to do that. Yesterday, as Dr. Morrison said, is our single biggest day of testing in this province since the pandemic started, with over 1,000 tests. Pretty impressive. And at the rate in which the tests came back just means that a tremendous shout out to those in the testing clinics and those in the lab led by Dr. German, of course. They were processing tests at a rate that was, we probably didn't expect, quite frankly. So what a great effort for them, and really unheard of probably in the country in terms of how quickly they were able to turn that around. We also had numerous crews from transportation, infrastructure, and energy who were called in to help with traffic control and other efficiency matters, and that was great. Norbert indicated briefly as well, but the Department of Education and Lifelong Learning in the Public Schools branch, the staff at Charlottetown Rural, all acted so quickly, stepped up amazingly when we needed it. And it was actually staff and others who were contacting individuals. It wasn't a call center. It was people like Norbert, Deputy Minister Bethany McLeod and their staffs and others. And that to me just it makes this, shows how important it is here to us, how much we care here as Islanders, and how quickly we were able to turn that around. The hockey P.E.I. protocols also proved to be very effective and efficient, and the rate at which they were able to share information with CPHO was important and helped us get people identified and tested. That was great. As I said yesterday, we needed an all hands on deck demonstration, and we had that. The system was ready, and our ability to execute efficiently is, I think, helps with the level of public confidence that Islanders find themselves with, particularly when we look at the rest of the country. So just in the days ahead, I mean, we have to continue to be careful and do the things that we've been doing. For those students who have been identified as close contacts, and there are about 70 of you, I know, I can speak from experience, 14 days of isolation is tough. There's no question, but you're doing your part in this by doing it. You're keeping everybody safe and keeping everybody healthy in your community. So it is a big responsibility. I know you're up to that, but we're going to do everything we can to make it as easy as possible for all of you. And I know the public schools branch, as Norbert has indicated, is working with you to make sure you have the online learning available right away, and you don't lose any important learning time as we get close to the end of first semester here. For the teachers, I would say that I've always known you do more than teach, and that's been evident these last few hours, last day and a half or so. You were trusted mentors to these students, and really do appreciate the fact that you've stepped up to the level that you've did. I know there's some anxious days ahead. That's totally understandable. But we're here to work with you and to do everything we can. And, those students that you teach every day, as you know, look up to you. And even though we're going to be covered in masks now at those schools, it's important that that they look up to you, and I appreciate so much the leadership you've been demonstrating here. And for parents, I would just say, I've told you before, I'm a parent as well. We all are. Take a moment and have that discussion with your children tonight. I know I will. Ask them if they're worried. Try to find out what they're worried about, and do what you can to alleviate that worry by answering their questions, and encourage them to have open communication with you on these and other matters, and that just let's have honest discussions. We don't have all the answers. We live with COVID every day in this province, and we know it isn't easy, and we know that it's here around us, but let's have open and honest conversations with each other and do the best we can. And as Dr. Morrison continues to say, follow the protocols. If you need to be tested because you have symptoms, go get tested, and that's great. And I would just finish off by saying that, our system has demonstrated that it has a capability to respond quickly. I'm overwhelmed with how we have responded here, and that leads me to really two final conclusions. We're very fortunate to be in the situation we are. We're able to do more in this province than we are seeing in other jurisdictions, and that's a great privilege that we've enjoyed. It's a privilege we've earned because we've followed these protocols, and now more than ever, it's important to continue to follow these protocols. But it also reminds us that, this COVID virus is a tricky bugger. It's around us. We can't let our guard down. Let's mindful. Let's look out for each other. We've gotten to this point together. The only way we're going to get through it successfully is to keep working together. So thank you for all you've done. Thank you to all you and your staffs. The response has been impressive, and let's look forward to tomorrow.